And ladies and gentlemen, just as we get started on this bill, I would ask that you remember you only have, those in the audience, you only have 2 minutes to speak. And if there's any disruption, if there is, when I close, when I ask you to close, if there's any delay in that, we're going to have to ask you to leave the committee room. So with that, Representative, do you want to, is there something you need before you get started?
Yes, Madam Chairman. I have two experts that are here to speak.
Yeah.
May I bring them up to the table?
Yes, please do, and please have them identify themselves for the record.
Yes, thank you.
I believe there are some people in the holding room that may want to speak for or against. So I'm not sure, but you might check. All right, are you ready? Representative, you might have your guests introduce themselves for the record, and then we'll get started.
Thank you, Senator Bledsoe. If I could have my guests introduce themselves, and also you have their resumes in front of you.
Okay. I believe we're passing those out.
My name is Charles Lewis. I am a psychiatrist, general psychiatrist in Arkansas, practicing in the Delta region in public sector psychiatry.
My name is Roger Hiatt Jr., MD. I'm a child and adolescent psychiatrist trained at UAMS and Children's Hospital here in Little Rock. I've been practicing psychiatry for nearly 30 years, currently in West Memphis and in Jackson, Tennessee.
Well, thank you for being here today. All right, Representative, you're ready, or Senator Clark, whichever one.
I'm going to defer to Representative Lundstrum.
All right.
Madam Chair.
You're recognized.
Thank you. House Bill 1570 prohibits sex change operations on children. This protects children in Arkansas from sex change operations as well as chemical operations or chemical procedures. The World Health Organization, the United Nations Population Fund, United Nations Children's Fund, and many other organizations universally recognize that genital mutilation on children, both surgically and chemically, is wrong. A profound psychiatrist, Dr. Christopher Gilberg, stated, "This is possibly one of the world's greatest scandals of medical history. These are children under 18. We are simply asking that they be protected." I'd like to yield most of my time to these two gentlemen that have driven here and given their time today. I would like to just have some things put in your mind first. There are no standards of care for this. This is about protecting minors. This does allow for counseling. This is a very tightly crafted bill. In medicine, the motto is first do no harm. My hope is that children would get to be 18. Many of you, I would hazard to guess, did things under 18 that we probably shouldn't have done and made decisions that probably shouldn't have been made. My hope is that people get to be 18 and can make adult decisions. We have outlawed or banned many things from 18-year-olds, such as alcohol, tattoos, drugs, smoking, going to a casino, renting an apartment, purchasing cigarettes, buying a lottery ticket, even changing your name. Why would we ever even considering allowing a sex change for a minor? This does still allow counseling, and with that, I would open it up to these wonderful folks that are here today.
All right, either one of you just decide who wants to go first.
Thank you, Madam Chair, members of the committee, for allowing me to come here today in support of this bill. I'm no lawyer, but the scientific basis of the bill is, as Representative Lundford said, is very tight. It's a very good bill. I'd like to start out with a little history. We've been here before. The transgender movement that we face right now is not new. There was a gender clinic at UAMS at the University of Arkansas in the 1970s. This corresponded to the same time that the most preeminent American research and treatment program for transsexuals was opened at Johns Hopkins University School of Medicine in the late 1960s. Being a research institution, their criteria for admitting people into their program was very rigorous. They were subjected to medical, psychological, psychiatric, social evaluations to make sure that this is what they wanted. They were given cross-hormone treatments, and then they were given the sex change surgery. Also, being a research operation, they followed these people for years, doing follow-up, evaluating their psychiatric and medical status. And those people had to agree to do that before they would even let them in the program. At the end of approximately 10 to 11 years, the program was closed. And the reason the program was closed was reiterated by Dr. Paul McHugh, who was the department chair at Johns Hopkins in the Department of Psychiatry for several decades. He said, looking at the data of outcomes after surgery, even though the patients said immediately after surgery they were satisfied, their lives later on did not mimic this. They had no change in their level of medical morbidity, psychiatric morbidity. Their suicide rates were the same, and their dissatisfaction and substance abuse histories were all the same after the surgery as before the surgery. The ethics committee at Hopkins decided that since we are offering no improvement to these people, we should close the service, because we're asking these people to undergo severely serious changes in their anatomy and cost, and they're not having any benefit from that. So that closed the American side of this particular type of intervention. In Europe, it continued. In Sweden especially, they were very rigorous about gathering data and keeping up with these people. And they published in 2011 a 30-year follow-up study tracking 324 patients from 1973 to 2003. Similar things that the Hopkins people looked at. What was their outcome? How did they do medically, psychiatrically? And they found some shocking things. The medical morbidity and mortality, death of all causes, happened at a higher rate with those who had had the surgery. Most strikingly, the suicide rate in the people having completed the transgender surgery was nearly 20 times higher than the general population. The explanations for this are being debated, but the data is clear. So the seriousness of this, you've probably noticed I haven't mentioned any data in children or minors. That's because there's not much. And what data there is are from small studies that are poorly designed. They don't have proper control groups. They don't have blinding. And many of the studies are funded by the industry that manufactures the drugs used for puberty blocking and cross-sex hormones. Excuse me. It's also important to consider the fact that these drugs that are being used in these studies do not have FDA indications for this use in minors. My primary concern is about the brain development being affected by puberty blockers and the cross-sex hormones. We simply don't have data on that. And it would be naive to think that those chemicals in the brain don't have an effect. We know now that hormones are used in the brain as neurotransmitters. If some of those hormones are blocked while a child or a teenager's brain is maturing, which takes place all the way up to age 25, we have no idea what this does to their brain. We have no data to fall back on. And as a psychiatrist, that's my primary concern, along with all the other medical issues. We also don't have any long-term or even short-term studies on the surgical procedures in minors for gender transition. And so I just would ask you to support this good bill for the protection of the children of Arkansas, and I yield to my colleague, Dr. Hiatt.
Thank you, Dr. Lewis. Madam Chair, members of the committee, It's my privilege to address you and support this House Bill 1570. I, as mentioned, did my training here in Little Rock and now have nearly 30 years experience working with children and teenagers in the psychiatric field. I'd like to point out that prior to about 2015, I only encountered just a very handful of young kids who identified as transgender, but that over the course of the past 5 years, I've seen those numbers grow exponentially, which is borne out by the literature. I have personally worked firsthand with dozens of children and teenagers who are dealing with gender identity concerns. I'd like to point out that gender dysphoria does not occur in a vacuum, that this is a condition that occurs in the context of severe psychiatric pathology, depression, anxiety, neglect and abuse often, suicidality very frequently. And it has just been my practice to address the underlying psychiatric conditions, the anxiety, the depression, the issues underlying, and to sit back and wait, I guess you'd say, to have watchful waiting for these children to declare themselves ultimately as transgender, or to desist into a gender identity that's consistent with their genetic makeup. The literature is clear on desistance rates. All the studies I've looked at, from a low of 80% to upwards of 97% of children who are left unto their own devices in childhood will desist by the time they turn age 19. And it should be pointed out that the suicide rate amongst transgender identified individuals, while about 19 times higher than the general population, does not improve after hormone interventions or even surgical procedures. The only thing that improves the suicidal outcome for these kids is desistance. And the more the interventions are undertaken to encourage the transgender identity, the less likely they are to desist, and consequently, the more likely they are to kill themselves. So I urge you to please advocate for the best interests of the children and teenagers in Arkansas and support House Bill 1570.
All right, gentlemen, when the chair said that that others would have 2 minutes, I didn't mean for the two of you. So if you have anything, I would love for you to go on. It's so interesting. But if you have anything to add, please do. But I do have a question. Tell me, you said something about 18, and if you the brain development and all of that. So either one of you, just tell me about the brain developing and the lack of development, maybe I should say, taking all these chemicals. How do you know? Tell me about how you know that it does something negative to the brain.
Well, that's as I said earlier. There's no real data on this. These are kind of theoretical ideas based on what we know about what little we know. I don't want to come across as a lot of times medical people come across like we know more than we really know. The brain is the most complicated organ in the body. We know less about it than any other organ system, but we do know some things. We know from neuroimaging studies, kids, teenagers, young adults, that brain functioning develops over time. You're not born with the same brain that you wind up with when you're 30. There are more neurons being formed. There are more connections between neurons being formed. And all of these things depend, we think, on cycles of neurotransmitters being applied at the appropriate times. Some of those neurotransmitters are hormones. We know that there's a lot of estrogen in the brain of males and females, more in females, but some in males. That's used as a neurotransmitter. If you use puberty blocking agents in the middle of this maturation process, you will shut down the production of one or the other of the sex hormones. It seems logical that that could have profound effects on cognitive functioning later in life. But again, we don't have longitudinal studies like they have in the adults. They have that in the adults, but we don't have that in children and adolescents. And that's my biggest worry, is we're doing something we don't get a do-over on. If this goes bad, you can't go back and fix this.
Thank you. Sir, did you have anything you wanted to add?
Well, I would like to add that in addition to the physical and physiological impact that the hormone, whether it be puberty blockers or cross-sex hormones interventions, in addition to the physical impact, there's a psychological, a mental impact that can't be ignored. And many, I would say most of the young people whom I've dealt with who identify gender dysphoria as a primary concern become hyper-focused on the issue to the point that productive work on the depression, the anxiety, and the abuse victimization and so forth is adversely impacted.
Okay, thank you. Any questions from the committee? All right. I want to ask you, do you have any papers that are published on this?
I'm sorry, that we've published or that we've read?
You've read or, well, published. The reason I'm asking that is this is the first time we have had something to go on. You know, so many times we think, could that possibly be good? And so,
Yes, we've reviewed literature, Dr.
Oh, yes. And I can, if given an email address, I can forward
Okay.
those to members of the committee that
That
would be
would be
interested
wonderful.
in looking.
yeah, I think Representative Lundstrum could give my email address out, and I could get it to Mr. Price, and he could forward that to the members of the committee. All right. Any other questions? Okay. We've reached the point where we ask the audience to speak for or against. Thank you. Thank you very much.
Thank you.
And
Thank you.
we have 13 people that are here to speak against, and I'm just going to start down the row. Justin Sarlo, are you here in the audience? All right. Billy McBride. Okay, could, sir, would you ask tell them that it's time to speak for and against, and if they would come in and take a seat? Okay. All right. Are you Justin Sarlo? All right, since we're waiting on the others, why don't you come to the table? And I don't know if you heard this, sir, but 2 minutes, that's right. Just right there in that chair, right there in the microphone next. The first microphone you can find. All right, tell us who you are, where you're from.
My name is Lance LeVar. I'm a citizen of North Little Rock, and here speaking, representing myself.
All right, you're recognized, and we're starting the clock.
All right, thank you. We've heard a number of things that I'm not going to speak on the medical because I'm not a medical professional, but I can tell you my own experiences. I can tell you that similar bills and court cases have had amicus briefs and others written against by 50 civil rights organizations and another one by 13 medical organizations, that these are not good. In fact, some of the things that they discover in there, he spoke about suicide. When you're not allowed to be around or be who you are, suicide is much more likely to happen. We speak about the fact that we've seen more of them lately. We've also seen more autism diagnoses in a while. We've also seen more of other types of diagnoses. Having more now doesn't mean that somehow there's some kind of influence that you have to do it. It means finally you're being accepted, and we're trying to find ways to help you. I'm going to tell you about my niece, May. I had a chance to hear from her that she was my niece now. I had an opportunity to either listen to the little bits of pieces in my mind that said, what's going on? She just doesn't like to dress like a guy or something of that type. Instead, I actually went to an expert who had actually treated hundreds of people, and he helped me figure out the differences in the ideas. Get close to find out how to understand. And I'll take any questions from anyone.
Okay, thank you. Questions from the committee? All right, seeing none, thank you so very much. All right, I'm going to call some of these names out again. I guess everyone that wanted to speak against the bill is coming in from the committee. So, I'm sorry, from the holding room. Justin Sarlo, Billy McBride, Cash Ashley, Chris Attig. Okay, if you would come forward when I call. Okay, now you have to sit right there, please, sir. And state your name and where you're from, and you only have 2 minutes.
Yes, ma'am.
All right.
My name is Cash Ashley. I'm from Little Rock, Arkansas. I was born and raised here. I also attended college here. I'm currently the head chef at Reduno Brick Oven and Bar Room on South Main Street. I am also a trans man. I have a feeling that there's very little I can say to change the minds of those here that need changing, so I'm going to save most of my energy for me and my community. However, I did feel compelled to go on the record, say that I very strongly oppose this bill. It not only creates many problems, including further marginalizing an already marginalized population, but it pretends to fix a problem that doesn't even actually exist. If this bill passes, people will die. I wish deeply that this weren't hyperbole. Trans youth aren't being experimented upon in receiving scientifically backed trans competent care. Those of you who support this bill are the ones experimenting with the lives of young trans people by testing whether or not they can survive the onslaught of horrors through which you are subjecting them. Had I received trans-affirming care and or trans-competent care in my youth, I may not have tried to take my own life when I tried to kill myself once when I was 15 and once again when I was 17. The world is already a hostile place towards trans people, especially trans youth. Please don't actively choose to additionally instill violence by creating barriers to care, which is what this will do. Trans people have always been here, we will always be here, and you cannot erase us. Please stop trying. Please vote no on House Bill 1570. Thank you for your time.
All right, thank you. Questions from the committee? Seeing none?
No one wants to hear from a trans person?
Well, I think there are some others that are here to speak. Thank you, Mr. Ashley.
Thank
We
you.
appreciate you being here. All right, the next one is Chris Attig. If I've pronounced that correctly, I hope. Come forward, please, sir. Tell us your name again and also where you're from.
My name is Chris Attig, and I'm here
Attig.
from Little Rock, Arkansas, and I'm speaking for the fathers of all the transgender children in Arkansas who had to work or take care of their families today. Let me first speak directly to Arkansas's transgender youth with the love of a real father. You are loved. No matter what happens here today, you are loved. We will prevail against this hatred. Stay alive, no matter what. Quick trigger alert, this testimony contains distressing material involving trans suicide. I'd like to read to you the abridged words of Ashley Harrell, a young lady born in 1989 and died in 2015. She wrote, "These are going to be my final words. I can't stand to live another day, so I'm committing suicide. I am transgender. That means that even though I was born in a male body, I am and have always been female. I've known I was female for as far back as I could remember. This caused me to become severely depressed from a very young age because I was told that people like me are freaks and abominations, that we are sick in the head and that society hates us. This made me hate who I was. I tried so hard to be just like everyone else, but this isn't something you can change. It wasn't until I was 20 that I found out I wasn't alone. I had hope that I would finally be able to live as I am and love who I am. I finally came out as transgender and began transitioning. For the first time in my life, I was genuinely happy. Despite this huge change, I never got over the depression. Everywhere I'd turn, I'd see the hate that society has for us. I'd already been poisoned by a society that didn't understand us, and even worse, didn't want to even try. I saw the pain caused to people like me, and going through the same hurt myself, it has just become too much for me to take anymore. You need to know that I'm not just another face of someone you never met. I was alive. I had a family and friends that I loved very much. I loved being around those that I loved. I loved listening to music and singing. I loved going out to eat with friends and enjoying good food. I was a real person. Trans people are everywhere. You may never know who you're hurting until it's too late. Stop persecuting my kid. Stop hating my kid. Stop bullying my kid. The state does not belong in my family's medical decisions, and it does not define my children's identity. Please vote against this bill. Thank you.
Thank you so much. All right, Courtney Frierson.
Hi,
Hello there.
I'm Courtney Frierson, a social worker with 13 years experience providing therapy to transgender community in Little Rock. There is no surgeon in Arkansas performing surgeries or experiments on children. This bill is unnecessary because it aims to stop something that does not actually happen. There are already criteria in place for the standards of care for the medical treatment of trans youth, and that organization has overseen care for trans people for 42 years. The World Professional Association for Transgender Health, WPATH standards of care for children are moderate and cautious. They advise adolescents to slowly move through fully reversible steps, partially reversible steps, and wait until 18 for permanent steps such as surgery. Once again, there is no legitimate medical professional in Arkansas engaging in experimentation, and it is offensive to call it that. Let physicians do their jobs informed by accurate medical research backed by 42 years of WPATH experience. You can reference your email for the medical research that I emailed to all of you. There are trans children in Arkansas, and this bill will not erase them. It would create suffering, barriers to care, stigmatize them, and embolden bullies. In my therapy room right now, I'm hearing that sadly, my trans clients feel deflated, and this bill and the others in this legislature confirms their lifelong experience of being targeted and hated for their gender expression. To deny someone access to treatment to pursue their authentic gender is to deny their existence. Trying to extinguish gender expression is akin to conversion therapy to extinguish sexuality. Reparative therapies are condemned as ineffectual and harmful by many medical and mental health organizations, and they've been outlawed in 22 states. Legislating discrimination is on brand for Arkansas, but it's ugly and bad for business. It has a chilling effect on research. It harms Arkansans. This bill,
Excuse me
if
for
passed,
interrupting. I'm
is
sorry.
state-sanctioned violence against trans people. Please vote no.
Thank you so much. All right, the next one is Dr. Natalie Burr.
Good afternoon. My name is Dr. Natalie Burr, and I'm a general pediatrician here in Little Rock. I'm here today representing the Arkansas chapter of the American Academy of Pediatrics, which represents over 430 pediatricians in our state. And I'm here to ask you to oppose House Bill 1570. This bill would cause harm to the health and well-being of youth with gender diversity or gender dysphoria in our state. First, we do thank you for your concern for the youth of Arkansas, and we recognize that this bill does touch on a sensitive topic, even amongst our chapter members. As pediatricians, we walk alongside our patients and families in navigating the health concerns that arise from birth to adulthood. As a pediatrician, I'm one of the first people to hold a baby after it's born. I share in the joy and excitement of watching children learn to talk, walk, start school, and celebrate high school graduations. We also share in the heartbreak of chronic illness, disappointments, and loss that sometimes come along with growing up. We as pediatricians are not just professionally invested. We are truly dedicating our lives to keeping children healthy and safe. And this is why I feel that alongside parents, we are most qualified to determine the best course of care for our patients. This bill would penalize us for simply following best medical practices to provide or even refer for appropriate, effective care that is based in science and evidence, not irresponsible experimentation. This bill harms an already vulnerable group of patients, and it would cause immediate and irreversible harm to children already getting treatment in our state. removing access to gender affirming care could increase suicide rates for a group of children already at high risk. We oppose this bill because it undermines our patient-physician relationship, limits our ability to refer youth with consenting parents to care supported by medical experts. To the transgender youth of Arkansas, although this bill unfortunately reinforces the discrimination and hurtful messaging you so often get in society, please know that many pediatricians and the AAP stand with you and against this legislation.
Thank you very much. Thank you. We have some questions, or at least one. All right, Senator Sullivan, you're recognized for a question.
Thank you. I know you have 400 and some members. Was there a survey taken of those members, or was there a select board that made that decision to oppose this?
So, my understanding, I'm not on the executive board for the AAP Arkansas chapter, but for stances like this, they do have a board meeting for it. The advocacy board would have been one that voted on this, but on controversial issues that aren't really covered in our blueprint, then they would have the executive board vote, which is a board of 11 members, but you might want to confirm that with our executive director. And so the board voted to take our stance on this.
Okay, I see on that executive board, you have a member who's a former, you have two members from UAMS, one from Children's Hospital. Do you know if they are voting and those entities endorse the Pediatric Association's position?
I would not be the person to answer that. You'd have to follow up with our executive director.
Okay, thank you. Thank you, Madam Chair.
All right, Senator Hester.
Thank you for being here, your testimony. Do you think if parents had a child, say they had a boy and they wish it was a girl, that at a year old or 2 years old they could have start these blockers or have a physical change for the child? Do you think that would be appropriate?
No, I don't know.
So do you think at 4 years old that would be appropriate?
I think that that's a decision made in joint with parents and the wishes of a child, which is where gender affirming care comes in and referral to specialists.
So a 4-year-old should have say on if they're a boy or a girl?
I think that, yes. I think that a 4-year-old, you can listen to what a 4-year-old says.
Okay, but a 1-year-old or 2-year-old, how do you think?
I think that 1 and 2-year-olds developmentally generally do not have an understanding of what gender is at all.
Okay, so I think
Typical
I think
development.
that's my point. You agree that there's an age that's not appropriate. I also agree that there's an age that it's not appropriate. We're just now debating on what age is appropriate. So you're somewhere around 4 and I'm somewhere around 18. But we have the same belief that there is an age that it's appropriate and not appropriate for the decision to be made.
No, I think that a decision is made over time with input from family and professionals. I do not think there's a line in the sand when a child's gender identity is determined and it's forever that. I think that that is something that needs to be discussed with appropriate professionals and not decided on by policymakers or legislators.
But at 1 or 2 years old, that decision should not be made on behalf of that child.
Correct.
So again, we agree on that. Thank you.
Mm-hmm.
All right, Dr. Burr, did you tell me again, do you practice in Little Rock? Is that what I heard you
do.
say?
I'm a general pediatrician in private practice.
I see. All right. Any other questions for Dr. Burr? All right, seeing none, thank you so very much.
Thank you.
All right, Jennifer Steele. Is she, okay? We're setting the clock again, Ms. Steele.
Can you hear me?
Yes.
Okay. Let me see.
Introduce yourself, please, for the record.
My name is Jennifer Steele. I'm a Little Rock resident, a wife, and a mother, lifelong native. I had a whole spiel I was going to do. I'm going to go ahead and skip to what I think is the most important part.
Okay.
One of my sons is transgender. And what you guys are not seeing and not trying to see is how difficult it is for a person who is transgender before they are acknowledged and believed and supported. My son was a beautiful, happy 1-year-old, and he was at that time presenting as a girl. I had no idea. He was happy, he was chubby, he was fun, he was smart, he had everything going for him. As he grew up, he said, I can't wear dresses anymore, Mama. I was like, what? I was like, okay, fine, we'll just go with that. And I don't want to wear girls' clothes anymore, Mama. I was like, okay, I don't like the hoochie girl clothes from Target either. And then he aged out and he said he hit puberty. Dead spiral down, black, depressed, withdrawn, suicidal, cutting on himself, just dead quick. Puberty did it. There's no happiness with becoming a girl. None. I had no idea what to do. I had no idea what it was. I got therapy with him. I got therapy with the whole family. I did everything a mama would do. No clue. Still spiraled. One day he came home and he said, I get it, Mama. I know what I am. And I said, what do you mean? And what you're missing is the joy that that boy had on his face. It was like having God in the room with me to tell me, listen to your child. He said, Mama, I'm transgender. It means I'm really a boy. And I said, what? I had never even heard the word. No idea. This was quite a while back. Right. This was happening.
So sorry to interrupt you.
I'm sorry that y'all are missing it. And I'm sorry you're missing out on knowing all these people and supporting them. Because if you pass this bill, kids are going to die, and it's on y'all.
All right. Thank you so much. All right. We have Joanna Brandt. Please introduce yourself for the record, please.
My name is Joanna Brandt. I'm an Arkansas resident, a small business.
Excuse me for interrupting. Is your microphone on?
There we go.
There,
is that better?
Thank you. That's much better. Thank you.
So my name is Joanna Brandt. I'm an Arkansas resident and small business owner in the River Valley. I'm here on behalf of my son Dylan and the other transgender youth and parents that could not be here with us today. I thank you for your time and attention. I'm speaking now to those of you that may have already decided before you got here to support this bill or are on the fence. Those of you that oppose this bill like we do, I thank you from the bottom of our hearts. I have parented Dylan for 15 and a half years. I've had to make tough decisions over the years, always thinking first of his safety and well-being. The decision to seek gender-affirming medical care was no different, and I did not make the choice flippantly. I supported him from the moment he came to me and told me he was transgender. Even so, after many conversations with my son, I sought the advice and expertise of medical professionals. The idea of consulting lawmakers actually never occurred to me. I also searched my soul as his mother, who loves him dearly, as to what I felt was in his best interest. Today, after 2 years of therapy with both a local therapist and with the Gender Spectrum Clinic, and 7 months on gender-affirming cross hormones, Dylan is happy, kind, thoughtful, confident, and hopeful for his future, and his outside now matches the way he feels on the inside. I understand that you all think that you're doing the right thing. I understand that you believe you are preventing harm, but just because you believe it does not make it so. By supporting this bill, you are telling me that you don't trust me as a parent to make the right decisions for my child. You are telling me that you, who had no knowledge of me prior to today and have never met my son, somehow you know better than we do what he needs. Where will you be when you find out you're wrong? I am here asking you to allow medical professionals, parents, and patients to make these decisions, and you can all go back to the work of important issues that affect the majority of Arkansans. I also, if you've never had the pleasure of meeting a brave transgender child, just take the time, do your due diligence, meet my son, talk with him before you make a decision that will affect him.
Thank you very much.
Thank you.
All right, we have Kathryn Stambough. If you would introduce yourself for the record, please.
Yes, ma'am. Thank you for allowing me to speak to you today. My name is Dr. Kathryn Stambough, and I come today as a mother, as an Arkansan, and as a physician provider for pediatric and adolescent transgender and gender diverse patients. I would like to emphatically express my opposition to this bill. I know that we are all present today because we care deeply for the children of Arkansas. And what I would challenge you to think about is whether this bill advances these goals. And my answer to this challenge is a resounding no. I am gravely concerned that this bill does nothing to advance the care of what we know is an already significantly underserved population with often insurmountable barriers which exist to obtaining the care and support they need. And it is important to recognize that transgender and gender diverse youth face innumerable disparities, including inequitable laws and policies like the one before you today, societal discrimination, and unequal access to quality health care that they deserve. So what we know is that trans and gender nonconforming youth are aware of the differences in their gender at a young age, but there's often a significant lapse of time prior to any disclosure. There's an increased rate of depression, anxiety, self-harm, eating disorders, and most significantly suicide compared to their cisgender peers. And this is not because they are trans, but instead multifactorial and because of the society that they live in. And we know that part of these factors that are a lack of access to healthcare providers like myself with expertise in caring for transgender and gender diverse youth plays a large role. And so I would close with this. Transgender and gender diverse youth deserve every bit of respect, dignity, and care their cisgender peers are afforded. And their parents and caregivers deserve the same amount of autonomy to choose what is right for their child as the parents of cisgender children. And I cannot emphasize enough the enormity of damage this bill will cause. You've heard it today in individuals who've come before me. And so I will come back to my challenge to you. Does this bill advance the care of children in Arkansas? I would encourage you to dig deep and really think about that answer in relation to the mountain of data, which I am happy to provide you as well, that supports the very real, very positive, and potentially life-saving care a gender affirmative care model can provide.
Thank you so much.
Thank you.
Let me ask a question, please. You said that, are you a medical doctor?
Yes, ma'am.
All right, and you have a practice here in Little Rock?
Yes, ma'am.
All right, that's all I needed. Thank you so
Thank you.
much. All right, next on the list is Kirsten Sowell. Okay, would you introduce yourself, please,
Yes.
for the record?
My name is Kirsten Sowell, and I'm a licensed clinical social worker and in the state of Arkansas. And I've worked with over 200 kids in the last few years who identify as transgender.
Okay.
I'd also like to say, just in response to a question that you asked earlier, Senator Davis, or Hester, I guess. I just wonder if it took you until you were 18 to understand your gender identity as male, because I kind of wonder if that was true. Transgender teens and adults are the most informed population I've ever worked with. The teens I work with are excited to come to clinic, and they've already done a lot of research for years. However, no matter how well informed they are, something that you might know is that teens don't get to decide if they start cross-sex hormones under 18. Not even their parents get to decide. It is a team approach. For the teens that I know, it's at least a 6-month collaborative process to evaluate if medical intervention would be beneficial before they start medicines. They have a psychological evaluation by a mental health professional. They meet the nurse, doctor, social worker, and chaplain to help them understand the process and support them. In that initial visit, they have a mental health screen for depression and suicide risk. If they're not in therapy, they're given supports to get a therapist that understands gender identity. Within 6 months, they also meet with a psychologist who uses 5 to 6 research-based tools to help them really understand their gender identity and their goals and hopes for their future. They also evaluate mental stability as well, and if they need more supports, they're given different suggestions on how to work towards mental stability.
I'm sorry.
Okay.
You're out of time.
Okay.
Thank
Any
you so much.
questions for me?
Yes, does anyone have a question? Okay, Senator Hammer.
Thank you, Madam Chair. You're a licensed social worker, is that correct?
I am.
And you received your training from where?
Are you asking where I went to graduate school?
Yes, ma'am.
I went to graduate school at the University of Arkansas in Fayetteville.
Okay. And what were you taught? And I guess one of the things I've always wondered about, at what point do you as a social worker determine that you are not either equipped or what you are equipped with in the way of training stops being a approach from a mental health approach to where it becomes a medical need as discussed today? What's the line where you say?
So
okay,
my focus is on mental health, and then also in graduate school, since you asked, focused on gender and sexual minority studies as well as mental health. My focus is on mental health, and then I have the medical staff that is able to answer all medical questions.
okay, all right, thank you.
Yeah, you're welcome. Thank you for asking.
All right, we have Senator Hester for a question.
Hey, since you asked me, I think I'd like to ask you the same question.
Yes.
Is it appropriate
Yes.
for parents of a one-day-old child to start process of changing their sex?
That is such a very interesting question, and I'm not sure how it applies. And I'll kind of go back to the other senator that just asked me a question, and then I'll stick in my mental health lane instead of a medical question. Thank you so much for that, though.
I think you agree, as I do, that there's a day that you don't think is appropriate.
I don't think I agree with you on very much. Thank you.
All right, next on the list, we have Larry Todd Bergman, and I believe it says Reverend. So we have a pastor coming. And if you would please let us know for the record your name and where you're from, please.
Thank you, Madam Chairman. My name is Genevieve Bergman.
Okay.
My legal name is on record.
Okay, let me interrupt you. I read what's on this list.
Exactly.
All right.
And
Thank you.
I am an ordained elder with the United Methodist Church.
Okay.
I served as a pastor for 23 years. I served mostly churches that were rural, conservative, and very opinionated about a lot of things. One of the things that they were very opinionated about was LGBTQ issues. I spent 23 years talking with them about what the Bible says regarding people who are not like them, trying to open eyes to say that there is a certain way to treat people who are not like them listed in the Bible. After 23 years, I had to stop being a pastor because those good, rural, conservative Christians broke my spirit. The most hateful, venomous, vile comments about people who were different were coming from leaders in the church, people who were stakeholders in their community, people who had a majority of likeness over others. Finally, when I came out as a transgender woman, those good Christian people violated the church law of the United Methodist Church, removed me from my position, would not allow me to clean my office out unless the church was empty, then began to isolate me for the next 2.5 months and would not associate with me in any way whatsoever, displaying none of the Christian charity that they professed their Bible declared.
That's a point of order. You need to be speaking on the bill, please, ma'am.
Yes, ma'am. I'm getting there.
Okay. Well, I think you're out of time. So I'm very sorry. You have had 2 minutes and 5 seconds.
Okay. I would
All
be
right.
glad to answer any questions.
All right. And do you have any questions? Okay. Thank you so much. I appreciate you being here. All right. The next one on the list is, let's see, Stacy O'Brien. Please introduce yourself for the record.
Yes, good afternoon. My name is Stacy O'Brien. I'm here today because Arkansas's trans community should not have to bear the burden of justifying their existence. I'm here to tell trans children that we Arkansans love you and welcome you in our communities. I'm here to tell the sponsors and the tiny number of supporters of this bill that we Arkansans see you for who you are. Your mouths may say love, but your words and actions clearly say hate. Your mouths say do no harm, yet you do not heed the clear medical advice of people who actually took that oath, including over 60,000 pediatricians, 8,000 child psychiatrists, 120,000 social workers, and over 7 million youth-serving professionals. Your mouths say give them time to normalize, but your actions seek to outlaw completely reversible puberty-blocking hormones whose only purpose is to give gender non-conforming adolescents time to make thoughtful decisions. You put forward the false claim that 80% of transgender children desist with no intervention, but you either ignore or did not bother to learn that number comes from a single discredited study of gender non-conforming children. You shrink in feigned horror at experimentation, yet seek to enshrine into law non-consensual sex assignment surgery for infants while outlawing treatment that has been in safe practice for 30 years. We Arkansans see very clearly that your true goal is eugenics. Your true goal is to erase trans people from existence. You will fail. In the meantime, you will be remembered by Arkansans as the ones responsible for wasting millions of taxpayer dollars and for causing irreparable harm to our most vulnerable citizens.
Ms. O'Brien, thank you. Thank you very much. All right. Next is Willow Breshears. Please identify yourself for the record.
Is this on? Okay. Hi, I'm Willow Breshears. I am the founder of the Young Trans Women's Project, and I am an organizer at the Center for Artistic Revolution. First off, I just want to say that I am an out and proud trans woman, and no one, whatever her name, no one from the Family Council, and none of these doctors with real medical basis are going to tell me I'm not a woman. So let me just get that out of the way. I wrote a whole speech for y'all, but y'all are rarely guided by facts and evidence-based practice. So I really just want to say that bottom line, this bill is hurting kids. I have been on hormones since I was 13 years old. I have been on estradiol, progesterone, and spironolactone. I have never had any negative side effects from those. Sorry, this is very emotional. But you know, instead of sitting here and telling you all the bad things that have happened to me as a trans woman and sitting here and laying out my trauma, I just want to tell you how happy being like transitioning and living in my truth has made me. Without that, I probably wouldn't be here. I love my life. I am confident in myself, and this was the best decision for me. I have a loving family. My mom is very supportive, and I'm surrounded by people who love me.
All right. You are not out of time if you wanted to do something.
Oh, okay, I can keep going. Best believe.
Yeah.
Yeah.
So we're listening.
So I think bottom line, healthcare is a human right. So it is beyond me that any legislator would legalize discriminating healthcare, especially for children. Arkansas senators for the bill frame it as if it is merely elective procedures that will be restricted. However, with the ambiguous language used in this bill, they can deny transgender and other LGBTQ people any procedure that is deemed elective. Furthermore, medical doctors and other providers who aren't in endocrinology or women's health rarely provide minors hormone replacement therapy. It is a specialized thing. You don't just go to any doctor for it. It's difficult as is finding an Arkansas provider who offers adults competent hormone replacement therapy. It's much more difficult to find it for children.
Okay. Sorry, you are out of time now, but thank you very much for your testimony. I think we have 4 others. Let's make sure I have this right. Okay, Mo Hunter. Please introduce yourself for the record.
My name is MD Hunter. And first, I want to start off with saying that Senator Hester, at the age of 3, my family knew I was gay. I knew nothing about this, so it's not too crazy to think that someone could be born in the wrong gender. I'm a gay black male and a local drag artist who's an ally for the trans community. I first want to start up about the statistics of this bill, starting with the very first one, cited from the APA. It is not cited from the APA, it's actually cited from Wikipedia, which I actually printed out, and we should not be basing our children's health off of Wikipedia statistics. I'm also going to announce that the APA actually finds long-term mental health benefits from a gender-affirming care. So this bill, basing its facts off of these things, are completely incorrect. And because you've limited our time, I'm going to skip down to the very end because they have some people who are doctors who actually can speak about this. Transgender children and adults are some of the most powerful and brave individuals I can think of. Lastly, I would like to acknowledge the disrespect that the trans community have experienced during the meetings leading up to this. The people in general have been disrespected about the time limit to hear the people you represent. Representatives are supposed to represent the people, and we have been met with representatives from House leaving during opposing testimonies, gossiping in halls, blatantly disregarding the huge number of people opposing the bill, and on their cell phones. Just remember when the people voted you in and we can vote you out. This is about kids. You do not tell a parent how to raise their kid. Thank you.
Some may have signed up twice, so if I call your name and you've already spoken, you just say pass. All right, Elizabeth Barger.
Good afternoon. My name is Elizabeth Barger. I'm so glad to be here to address y'all, and I hope that I have everyone's attention.
Would you mind removing your mask?
I'm sorry.
It's harder to hear.
Yeah.
There you go.
Okay. I also had a lot of prepared remarks, but the speakers before me have been so amazingly eloquent, educated, concise, and have given y'all way more information than I could ever dream. This bill is maddening. I'm just mad as hell. I've been on spin for days since I found out. You can ask my husband how few hours I have slept the last several days as I've read and read and read more research that is completely contradictory of the way this bill is written. I'd like to add that I'm the grandmother of a transgender child. He's 18, and he's the light of my life. He's the neatest, wonderful kid. He's autistic. He's very mildly affected with autism, and for a while we thought his quietness was because of autism. And when he was 15, he came out, and the whole family has remarked, "Oh my God, it's like a light came on in that child. He's totally different, and he's awesome, and I love him so much." I thank God that at 18, he is out of the reaches of a bill like this that would tell parents and guardians how to make decisions for their medical care.
Thank you very much. All right, appreciate your time there. All right, Michele Hutchinson. I believe it's Dr. Michele Hutchinson.
Hi. I'm very short, so I'm going to try to raise this chair. You may not.
All right.
What side is it on? It's on this side? Well, you may not be able to see me, but you'll be able to hear me.
Good.
So yes, I'm Dr. Michele Hutchinson, MD, PhD. I represent myself and the almost 200 children that I have treated here in Little Rock for transgender.
Well, do you work at a hospital? Or
I do. I work at a local children's hospital.
Okay.
Yes. And I'm on staff there. So no prepared remarks. I just want to speak from the heart for these kids who really are the bravest, brightest, type A, high achieving, amazing children. I mean, I just can't go on enough about them. They're just amazing kids. Okay. And they know who they are, and they know who they are from a very young age. There are, ma'am, multiple published standards of care for the treatment of these children. There are multiple guidelines for the treatments of these children. The American Academy of Pediatrics, the American Psychiatric Association, the Pediatric Endocrine Society, the Endocrine Society, not to mention dozens of European pediatric and adult published guidelines. Many, many, many published guidelines, and we follow those guidelines to the letter because we care about these children and we want to keep them alive and healthy, not just in childhood, but after 18 as well.
Excuse me for interrupting you, but
yes,
if you would not look at the sponsor.
Well, it disturbs me when they say things that are untrue, and I want to correct the record. So I apologize. I will not do that again.
All right, thank you.
So we need to correct the record because the folks that spoke before got an awful lot of time to tell you a lot of inaccuracies. For instance, they cherry-picked articles that were in some cases 50 and 60 years old that have been misproven and debunked multiple times. There is a literal mountain of literature about how the care of transgender children keeps them alive. Okay? So the last thing that I want to leave with you, and guys, this is not hyperbole. I'm doing everything I can to maintain my sanity here. We've already had multiple children just after this bill passed the House. These kids heard about it. I've had multiple kids in our emergency room because of an attempted suicide. Just in the last week, multiple. I've had multiple children. Do you know how many phone calls I've had to field in the last week of children calling me saying, Dr. Hutchinson, if this happens, I'm going to kill myself. Multiple. So I guarantee you, if this bill passes, children will die, and I will call you guys every single time one does.
All right, thank you for your testimony. All right, would you take a question?
I'm done.
Would you take a question?
Of course. With pleasure.
Thank you, Madam Chair. A statement was made a while ago, and I'd just like to ask you in your medical or in your
Sure.
position that you're in. The statement was made, can be born the wrong gender. Can you speak to that, please? Because I'm having trouble understanding how you can be born
in the wrong gender. Wow, I'm going to tell you, if anybody who says they completely understand transgender would be lying. We don't completely understand it, sir. All I can tell you is that after having done this for 3 years, I know it's a truth. I can tell you I'm publishing a paper right now. The children seem to know their gender either before the time they can speak or by the time of puberty. It's a very clear bimodal distribution. It's very fascinating, actually. So to speak to you, Dr. Representative Hester, Senator, I'm a little nervous. Children do know usually at a young age who they are. Do we try to change the gender of a 1-year-old or a 4-year-old? That's absurd. Of course not. We wait until that child approaches puberty because multiple studies show that by the time of puberty, a child will know who they are, and they will certainly be old enough to vocalize it by that time. No decisions are made for these children in a vacuum. We're working with their families and multiple healthcare professionals. One last piece of data I want to leave you with, sir, is by the time these children come to my clinic, on average, they've known about their transgender status for at least 8 years, and some of them up to 13, 14 years. Imagine living with that for so long before you got somebody to help you.
All right, thank you. Any other
You're welcome.
questions? Seeing none, thank you. Thank you for your testimony. All right. The last one that has signed up is Justin Sarlo. Okay. We missed you at the beginning.
Yes, ma'am. I'm sorry. I just got off
That's all
work.
right. That's all right.
My name is Justin Sarlo. I was born in St. Vincent's in 1955 under the name Sandy K. Sarlo and the gender female. When I was 8 years old, Senator, I told my parents that God had made a big mistake. To be fair to my parents, the year was 1963. Their reaction was to send me to ballet lessons and put me in more dresses. I tried very hard to conform to who I wasn't, but by the age of 22, I couldn't take it anymore. I can't describe to you the pain a transgender person goes through having to live in the wrong body. At 22, I stepped in front of a dump truck, just hoping that God it would end it all. Luckily, he failed. I eventually got married, had 2 children, and when they were grown, they came to me one day and said, and I never said anything to anyone else since then. They said, "Mom, if you want to transition, we fully support you." So at the age of 55, I came out. And I discovered that God didn't make a mistake. God made me the way I am so that I can understand and help and mentor these kids, because I don't want any of them to ever go through what I did. Thank you.
Thank you very much. Thank you. All right, ladies and gentlemen, you have heard the discussion and you've asked questions. We've had lots of testimony. And what is the will of the committee? Oh, yes, please do. I'm so sorry. I forgot. I got so interested in the discussion and everything. I forgot. Please close, Representative.
Thank you, colleagues, and thank you for your patience. I want to address just 1 or 2 things, and then I will close quickly because I think we all know how we feel. These kids do matter. These kids are important. Every child in Arkansas deserves to get to 18 and make adult decisions. And I want to emphasize that counseling is not being touched by this bill because counseling is critically important. We all need good advice and good, wise counsel. They aren't marginalized and they're not being denied care because they matter and they are loved. I'm not going to argue with any side of this issue other than to say that the kids in Arkansas should never have this type of procedure done to them until they're old enough to make those decisions. And with that, I would ask for a good vote.
All right, ladies and gentlemen, you've heard the closing as well as all the other information. Do I have a motion? Have a motion to pass. I have a second. All those in favor say aye. All those opposed. All right, your bill passes. All right, go.
Thank you, Madam Chair. Thank you, committee.